My name is Chase Fuller, and I administered a norm-referenced test called the CAP, the Clinical Assessment of Articulation and Phonology, to a 3-year-old male at Rave. And at Rosewood, I administered a criterion-referenced assessment of neurocognitive disorders, and that was to a 68-year-old female. Both the physical environments were both different in the aspect, as one is for geriatric patients and the other one is for children. At Rave, the noise level was somewhat loud. There were a lot of kids just playing and running around, and it was pretty easy to get the child to respond to the first portion of the test, but once I got to repeating sentences back, he totally lost the interest. At Rosewood, I was able to do a majority of the test, but the patient suffers from dementia, so she kind of didn't really know where she was and would repeat the same type of information given to the type of question I was asking her. Between the two locations, one of them was a lot more loud, so, especially with other children around and they're all playing with toys and coloring and painting, there was a lot more distraction going on for the child. I teamed up with somebody else, so it was a little easier to get through all of the pictures in the CAP test, but once I got to saying a sentence and asking him to repeat it back after I said it to him, he would look at me after the third word and then stop looking at me and start drawing on the whiteboard. It was more just geared to hanging out and playing with children. As far as the environment goes at Rosewood, we were inside of a rec room, and it was just, kind of different in the aspect of it was quieter and just overall a lot different than being at Rave. For the directions that I gave the 3-year-old male at Rave was, hey buddy, I'm gonna ask you some questions and I just want to see what your answer is. And he was up to it until I got to the second portion of the test. Then it was kind of like, yeah, no, I'm not gonna be doing this. At Rosewood, it took a little longer to get into the vibe of doing the test with the patient. They suffer from dementia, as I mentioned earlier, and it would take a lot longer for her to answer the questions. The directions were pretty straightforward. I'm just going to ask you some questions about, the time, the day, where we're at, and along the lines of that. And it just took a lot longer. Any time that the boy at Rave would answer questions, I would tell him good job, give him a thumbs up, and continue on to the next. With the geriatric patient at Rosewood, I was more so able to kind of carry out specifics once she was answering, and we would get a little longer into a description of the answer to that question. I didn't really have to give much redirection to the geriatric patient. She was just sitting there, and for the child at Rave, I had to kind of keep him on task a little bit more, but not too much. What I learned from this experience was that having patience is something that matters with both clients of having geriatric and having a child. I learned that it would take a lot longer for specific patients in working with geriatrics. It would take longer to assess them because of failing memory or any kind of other cognitive delays that they may have. And with the pediatric client, their attention span is much smaller, especially when they're around other children that are playing. It's really important to have the patience with both of these different people that you're going to be working with. Sometimes, it's beneficial in practicing patience for both. And in light of this, I'll continue to work more on my patience and to understand that in this line of work, you must have skills in being patient.